All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So, the Attorney General of Oklahoma has done something that our healthcare administrations should have done. They have not done it, and they continue to insist on not doing it. So, I want to start with the statement, and I want to then align the statements from the Oklahoma's Attorney General, who is a lawyer, not a doctor, to the Hippocratic Oath to see how well they are aligning and if the same way of thinking could be taken to the healthcare administrations, there would be a lot of benefit to the people. So let's start. So here is the summary at the end of this statement. This is the statement. Attorney General O'Connor assures Oklahoma physicians are not prohibited from prescribing off-label medicines to fight COVID-19. Good. Then he says, and I would go through the rest of the statement, but I want to read the last part. The Attorney General's office neither condones nor condemns a specific course of treatment for COVID-19. Our office maintains that proper healthcare decisions are to be made between a patient and his or her physician, and the government should not interfere with their relationship. So there are so many layers to kind of unpack and peel and look at this. I would put one seed in your mind right in the beginning. There is definitely a concern in general to say, well, a doctor might start making some home cooked remedies and then start selling them, saying, I'm a physician. So we should regulate and we should protect people from that. And so what happens is organizations like FDA and CDC come into the existence to help us. These are our agencies, and they are supposed to help us figure out what is to be approved and authorized so that we can use them. Once they have authorized and approved something, then there is a liberty, there's a freedom of off-label use, which is between the patient and the doctor, with all the proper information exchanging and consents given. So now let's look at where we stand with this. So this is the discussion of the Attorney General's statement. We are in the Omicron era. This is what is happening at this time from our healthcare leadership and healthcare agencies. The doctors are sitting with their hands tied, and the Omicron and the SARS-CoV-2 is just running around. It is very kind of the virus that it has started becoming less and less virulent. Otherwise, we still have a lot of damage, and I think our healthcare leaders are really, in my opinion, not helping us get out of it. So this is a medical disclaimer. This is not a medical advice. This is just a discussion. Now, we just saw this. I'm going to now go over the statement part by part and align that to the Hippocratic Oath. And here is the oath. So Hippocratic Oath has many flavors. And let's look at the picture of this awesome, amazing human being, John O'Connor. So Hippocratic Oath, there is an original text, and that original text has some gods and idols in there as well to pray to. But at the end of the day, there is this version of the Hippocratic Oath that is more popular in medical schools. So I'm going to use this to have this discussion. So let's start. So first, the Attorney General says, he responds to inquiries about whether an Oklahoma licensed physician is prohibited from prescribing a drug approved by the U.S. Food and Drug Administration for the off-label purpose of treating or preventing COVID-19. So here there is an important thing, and that is the off-label. So he's not saying that if a doctor has built a cocktail at home of non-approved things and said this should be for COVID, he's not saying that. He's saying those drugs that have been approved, there are regulations and laws to be able to use them in off-label. So we are not stopping our physicians from doing that. And you know that physicians are under lots of pressure and threat. We are under pressure and threat to even just to talk about them. So imagine those brave souls who are actually prescribing. So in the Hippocratic Oath, there is a clause that says, I will apply for the benefit of the sick all measures that are required, all measures that are required, avoiding those twin traps of treatment and therapeutic nihilism, but all those measures that are required. Do you feel that in today's environment, the doctors are enabled, empowered, and allowed to deploy all measures that are available? And you would see that in the Hippocratic Oath, there is going to be something about prevention and prophylaxis as well, which again, we are not really there. The Attorney General's office finds no legal basis for a state medical licensure board to discipline a licensed physician for exercising sound judgment and safely prescribing an FDA approved drug like ivermectin or hydroxychloroquine for the off label purpose of treating a patient with COVID-19. So they're saying we legally do not find any reason that the medical board should stop a doctor from using off label medicines for COVID, for whatever. I can generalize the statement. Here they're talking about COVID. And in the Hippocratic Oath, we say, I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect the person's family, economic stability. My responsibility includes these related problems if I am to care adequately for the sick. Hippocratic Oath also says, I will prevent disease whenever I can. I will do prophylaxis. For prevention is preferable to cure. And we are seeing that when we do not do appropriate prevention, we are then struggling with the rapidly progressing disease that starts killing so fast. Here, the Attorney General is upholding the Hippocratic Oath. He's a lawyer, finds no legal basis for state medical licensure. And how good, how wonderful it is for the physicians of Oklahoma, because the physicians in other states are under lots of pressure. I had read to you even insurance companies' letters to physicians to say, how dare you prescribe something to our members as if we're their sheep? And then American Medical Association, and then other state boards bringing problems, threatening to cancel licenses, hospitals firing doctors. And here, Attorney General says, I find no legal basis for medical licensure boards to discipline a licensed physician for exercising sound judgment and safely prescribing the FDA approved drugs like ivermectin or hydroxychloroquine for the off label purpose of treating a patient with COVID-19. Then he says, I stand behind doctors who believe it is in their patient's best interest to receive ivermectin and hydroxychloroquine. Said Attorney General O'Connor, our healthcare professionals should have every tool available to combat COVID-19. Public safety demands this. Physicians who prescribe medications and follow the laws should not fear disciplinary action for prescribing such drugs. Off label is actually allowed. I will apply for the benefit. So, this is the Hippocratic Oath. I will apply for the benefit of the sick all measures that are required. And then one more clause, I will remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. How much warmth, sympathy, and understanding do you feel nowadays from those who have taken the leadership of the healthcare systems? And I'm not pointing at any one person, the whole community. I will remember that there is art to medicine as well as science. I will not be ashamed to say I know not. How many doctors today say, you know what, I'm not aware of this thing, I do not know this, let me go and get myself up to date? It is part of the Hippocratic Oath, if they believe in it. I will not be ashamed to say I know not, nor will I fail to call in my colleagues that when the skills of another are needed for the patient's recovery. Here, the community is cutting down each other. Somebody says, here is a, I cannot imagine this, that there are studies. For example, you are seeing some monoclonal antibodies being authorized again. The testing is actually in vitro, and the control group does not exist. It is a control group from the other placebo, other monoclonal antibodies testing. And fine, that is another tool for us as well. That is a physician's behavior right in front of you, that yes, okay, they did that and they feel there is a benefit in there, we should use that. Why isn't that behavior more generally deployed? There are drugs, these are not approved drugs. These are approved drugs. The approval means that their side effects have been seen and studied and people are aware of them, their dosages are seen, their usage is seen, we know what to do if there is a problem, and so on. So I will not be ashamed to say I know not. And I feel here we medical community is falling short as well. Leadership on one side, practicing doctors. The Attorney General's office neither condones nor condemns a specific course of treatment for COVID 19. Our office maintains that proper healthcare decisions are to be made between a patient and his or her physician, and the government should not interfere with their relationship. There is actually a privacy between the patient and the doctor. No one, government or agencies, the boards, no one has a right to get in there between them. I will respect the hard won scientific gain of those physicians. This is Hippocratic Oath. I will respect the hard won scientific gains of those physicians in whose steps I walk. Somebody did a study, they said it is working, and gladly share such knowledge as is mine with those who are to follow. This is part of our Hippocratic Oath to do this. How many people are allowed to share? We gladly share nowadays journalists, pundits, talking heads who have no clue what medicine is, and we share their messages all the time. But the physician whose job it is, whose part of the value structure is to share knowledge with others, are not allowed to. And then once again, I will not be ashamed to say I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. I will respect. So, look, once again, the Attorney General, a lawyer, is standing up, thankfully, is standing up and saying the correct practice is here. I will respect the privacy of my patients when their problems are not disclosed to me, that the world may know. Most especially must I tread with care in matters of life and death. If it is given me to save a life, all thanks. But it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play a god. Now, I want to give you an example as well. This is the discussion I wanted to do. A lawyer stands up, an amazing human being in the first place. I do not know what their political leanings are. a human being stands up, who is in the position to stand up and say something which matters, and he says, fear not, go prescribe, go practice as you seem fit and your patient seems fit. And I'll tell you that there are going to be doctors who would say, this patient does not need to get this medicine, and that patient needs to get this medicine. This patient has a cardiac problem, I'm not going to add this. So they're taking this medicine, and I'm not going to add that drug. You think doctors are fools? They cannot think that much? So he is saying, I stand behind them. They should not be afraid of making decisions with their patients. And I want to give you an example of how bad this system is at this time. Here is Emma. American Medical Association had categorically spoken about hydroxychloroquine and said, do not use it for COVID. Some folks objected and said, your own policy says that you will not interfere in off-label usage or between a patient and a doctor's practice. To which they said, we affirm that we believe that and we stand behind that, but in this case, we reject the usage of our own morals and values. This is American Medical Association for us. The morals, values can be suspended, in my opinion, when it does not suit their narrative. Where the narrative is suitable, then all rules, regulation, and look how pristine and clean and neat we are. Look at this. This is American Medical Association saying, our American Medical Association confirms its strong support for the autonomous clinical decision-making authority of a physician, and that a physician may lawfully use an FDA-approved drug product or medical device for an off-label indication when such use is based upon sound scientific evidence or sound medical opinion. And then they keep going, and this whole thing is about that. But do you know what they're saying here? Can you imagine the sleight of hand? They are actually presenting this over here and then saying, we affirm that we believe this. However, we reject using this policy for hydroxychloroquine for COVID. How about that? And in the timeline here, they said, because this policy was nominated to talk about hydroxychloroquine, we affirm this policy once more. But hey man, hydroxy is not going to be allowed. And so this was the hydroxychloroquine and combination therapies off-label use introduced by Georgia. And so here are the Georgia coming in saying, guys, look at your own policies. That our American Medical Association rescinds its statement calling for physicians to stop prescribing hydroxychloroquine and chloroquine until sufficient. So this was their statement, and this person, or Georgia state, whoever, I think it's a person, said, rescind your statement. That does not align with your own position. And they simply said, not adopted. But we confirm what we said before about the policy. We once again affirm it. And so here, this is their statement afterwards, the joint statement. And I have discussed this before, that is why you're seeing it highlighted, in which they said, we also strongly support a pharmacist's professional responsibility to make reasonable inquiries to a prescriber to resolve any questions about a prescription. To resolve any question or reject them are two different things. Physicians, pharmacists, patients, and policymakers must understand that these medications have dangerous side effects that may lead to patient harm, including fatal cardiac arrhythmias. Have they come out with any assessment of the current therapies being used or current therapies being given? Myocarditis study just came out a few days ago. Did you hear anyone looking at that and saying, we may have a problem? So once again, Beautiful human being, this Attorney General O'Connor, and great job that he's done. He has taken fear off of a doctor from working the way they are trained to. And I can assure you that doctors are responsible people. They've been trained that way. From the very first day, when I entered my college, the first day, usually we used to take the Hippocratic Oath at the end of the medical training. Our principal came to us and saying, "Welcome." And the very first day, he made us stand up and take this oath right there. And he said, "For me, you should keep this thought in your head from the beginning, that this is what you are." And he also said one more thing that was very interesting for me. And he said, "Look, you guys are becoming something where in a society where a woman is not sometimes even shown to people, they would allow you to come into their house, open the front door, go in the house, go to the back rooms, and go and see their woman, maybe sometimes even ask her to remove parts of her clothes." He said, "This is the kind of trust the society will put on you. You have to work for it and abide by these." So we took this oath. I still can remember that feeling. So this is the discussion. Thank you very much. I will see you this evening as well, and we'll go from there. If you would like to support this work, the best is there is drbeen.com. You can buy a subscription there. That is awesome as well. And in addition to that, if you would like, there are links in the description. You can use them to support this work. Thank you, and I'll see you later. Bye bye.